Hi there, my name is Dr. Jason Strandberg. I'm the medical director of Lake Minnetonka Mobile Wellness, and I wanted to talk to you all today a little bit about what we are hearing people say is the COVID long haul syndrome, or long COVID. So, what is long haul syndrome or long COVID really all about? Um, in normal COVID-19, a typical mild to moderate case will resolve within 2 weeks, but some people who have had this COVID and seem to get over the symptoms for the most part keep having lingering symptoms. Now, they can be mild to severe and they can last weeks, they can last months. We don't know. They may last years or forever because COVID-19 is still a relatively new thing. Typically, we consider somebody long-term COVID or a long hauler if they have tested positive, recovered, and are no longer testing positive for COVID-19, but continue to have signs and symptoms of it. Now, who gets it? Even though we think people with the pre-existing health conditions like heart disease, diabetes, tend to be more susceptible to getting COVID-19, it doesn't seem to directly relate to who gets long haul syndrome. In fact, according to the Mayo Clinic, about 3/4 of the people who have long haul syndrome were never sick enough to be hospitalized. So while the same risk factors for getting COVID seem to be the risk factors for having long haul syndrome, the severity of your case of COVID doesn't seem to have anything to do with whether or not you're going to have the long-term COVID. Now, what causes long COVID? We really aren't sure. There are a whole bunch of theories, and I think the ones that make the most sense are either things that are related to blood vessel damage or the inflammatory response. We know when somebody is infected with COVID that it does damage to the blood vessels and actually causes them to leak fluid and the capillaries pretty much die or burst. This causes the swelling, the inflammatory response that we see in the lungs, in the heart, and all of that. And this is also what probably causes some of the long-term damage. And also, we see a lot of people who have brain fog and have a whole bunch of other neurological problems. And these problems are probably related largely to damage to the blood vessels in the brain. The immune response may also cause some damage, whether it's the inflammatory process itself or something to do with the B cell, T cell response to the initial infection, where we see the people who have this long-term COVID, as soon as they get vaccinated, tend to get better. And it is definitely compounded by people having those same pre-existing conditions that made you more likely to get COVID-19, such as diabetes, heart disease, etc. Now, the signs and symptoms of long COVID can be numerous. I've listed a few here, but you could have loss of smell or taste that continues even after everything else is good. Fatigue is definitely a common sign and symptom that we see in long COVID. Shortness of breath and difficulty breathing, chest pain, joint pain, muscle aches, headaches, problems concentrating or sleeping, memory problems. And I've seen patients with congestive heart failure or post-stroke because of COVID-19, and we're seeing, neuropathies, depression, anxiety, all sorts of problems that can be related to COVID-19. The majority of things we're seeing in our office tend to look a lot like fibromyalgia, chronic fatigue syndrome, where there's just multiple joints and muscles that are affected and lots of pain. But we also have people that we've gotten onto rehab programs for congestive heart failure, and even some of the other more serious problems. Now, how do you treat long haul COVID? Don't get COVID is probably the best thing I can tell you. How do you not get COVID? Get vaccinated. There are 3 vaccines in the US, there are 4 worldwide that seem to be doing amazing things. So if you have access, it doesn't matter whether it's to the Moderna, to the Johnson & Johnson, whether it's to the AstraZeneca, to any of the vaccines that are approved around the US, Canada, since that's where you're most likely watching this. Get a vaccine. They're safe. They're amazingly effective. And until you are fully vaccinated, wear a mask, social distancing, and do all of the things that we've been saying for the past year so that you don't get COVID. If you don't get COVID, you can't get COVID long haul syndrome. If you do have COVID and are dealing with long-term symptoms, there are a bunch of things you can do. The first one is, if you haven't gotten vaccinated, get vaccinated. The long haul people that we've seen who get vaccinated tend to see an improvement in their symptoms. Some of them have complete remissions. And if that doesn't get rid of all your symptoms, then find a multidisciplinary health team that will help you evaluate this. The long-term symptoms can be very different and can need different types of treatment. And so what you want is a team that will work together and give you the most complete and proactive treatment plan that's possible. So different symptoms are going to require different treatment. If you have congestive heart failure because of COVID, or if you have basically an emphysema or other respiratory problems because of COVID, you're going to need special medical evaluation. You're probably going to be on long-term medications and need to set up some sort of rehabilitation programs. Things like neuropathy, fatigue, muscle pain, joint pain can respond to treatments like chiropractic, acupuncture, laser, infrared treatment, and also to certain medications and rehabilitation programs. Headaches, sleeping problems, anxiety, memory, confusion, concentration problems, they can benefit from this multidisciplinary approach as well. We use at our clinic, we use manipulative medicine, we use exercises, we use acupuncture, massage, and of course medicine to treat patients. And many of these problems are still coming to light. We are probably going to learn more and more over the next year or two about long-term COVID symptoms, and we're going to be better and better at treating this. So what you want to make sure if you have long-term COVID is that you have a healthcare team that will listen to you, figure out what's important to you, what we can do to help, and things that are, and get you up to the next level, get you better as quickly as possible. And if new, better treatments come along, that team is ready and willing to adapt them if it's appropriate for you. Now, the clinic that I'm a medical director at, Lake Minnetonka Mobile Wellness, we have a multidisciplinary team that helps people achieve health goals of all sorts. We have medical providers, chiropractors, rehab experts, medical acupuncture, therapeutic massage, and all of these things we use in conjunction with one another to help people achieve health to the level that they're hoping to get it. Some people that means just not having pain. Some people that means being able to run faster, jump higher, and all of those things. We take those into consideration when we set up treatment plans. So obviously we treat headaches, joint pain, back pain, knee pain, all these things that could be part of the COVID long-term syndrome. We help people with weight loss. We help people who are athletes improve their game, musicians be able to play longer and achieve their best health. And we do treat people with COVID long-haul syndrome. So if you have COVID long-haul syndrome or know somebody who does and you live in the Minneapolis-St. Paul area, give us a call, 952-222-7886, or find us online at LakeMinnetonkaMobileWellness.com. We can help you get through this through our multidisciplinary approach. And we look forward to helping you.